So we all know that burning sensation in the chest after a heavy meal, or that discomfort that creeps in when you try to sleep too soon after a meal. Well, what if this isn't just an occasional problem? What if GERD, gastroesophageal reflux disease, is reshaping not only what you eat, but how you sleep and even how you feel about day-to-day life? I'm Sohani Khan and welcome to the Gut Feed podcast. Today, I'm speaking with Dr. Rakesh Kumar about how GERD affects our routines and the small but powerful lifestyle shifts that can help. Doctor, what exactly is GERD and why is it so common today?
So GERD or GERD, simply it is called gastroesophageal reflux disease. Whenever you have reflux of gastric content into your food pipe, in your esophagus, then this is called GERD. And when stomach content goes frequently back into the esophagus, which is a tube which is connecting your mouth to stomach. So occasional reflux is normal, but when it become more frequent, then it is a concern. And on long-term basis, it can cause many side effects to the body. Like initially, because acid is not normal to esophagus, so esophagitis can occur, esophageal inflammation can occur, esophageal ulceration or even Barrett esophagus, which is a pre-malignant condition, can occur on long-term basis. So it should not be ignored. And there are multiple factors which are the causative agent for GERD, like obesity and some physiological condition like pregnancy, certain medications, smoking, alcohol, and sedentary lifestyle, eating too much, drinking too much of water along with your food, and spicy food, stress. These are the factors which can aggravate your GERD symptoms. And all these increase pressure in your abdomen and making reflux more likely.
So then what are some symptoms that people might not realize that are actually linked to GERD?
So there are many extra intestinal symptoms, like the most common symptom is heartburn. Heartburn means then gastric acid is refluxing to esophagus. You have feeling of burning sensation in your chest. And in common language, this is called heartburn, but it is not related to heart. And it is a feeling of burning sensation in your chest. So commonly, sometimes it is called heartburn. And the other symptoms, if reflux goes up into your mouth, then it can cause sore taste. It can erode your enamel in the teeth and can have sensations in teeth. And it can cause laryngitis, where you have difficulty in your speech. And it can cause chronic cough when it irritates your respiratory passage. And even on long-term basis, it can cause asthma-like symptoms. Even in my adolescent age, I have cough and I was not able to find the cause. Many cough medications are not getting me relief. So when I have joined my medical school, my MBBS, then I realized that this reflux is causing me cough. And after that, modify my lifestyle, much improvement in my cough problem.
And how does GERD actually affect someone's day-to-day life?
Quite significantly, the discomfort can interfere with sleep, focus, and even productivity. Many people start avoiding certain food or social situations. They start avoiding going to parties, and because they are afraid of triggering heartburn and the belching symptoms. Over time, that constant unease can affect your emotional health, and that will lead to stress, and stress will lead to GERD. GERD will lead to stress, and they will indulge in this cyclic event. And so it's not just about the acid, it's about the quality of life.
True. Can GERD be managed through making just lifestyle changes alone?
Yes, for many people. Yes, simple steps like the avoiding lying down soon after meal. I recommend at least 3-hour gap of your last meal and going to bed. And because 3 hours stomach acid, your food will mix with acid in his stomach, and after that it will pass. It takes around 2 to 3 hours. And the other, you should eat smaller portion, and you should chew at least 32 times before swallowing, and you should be steering clear of triggering foods like spicy food, acidic dishes, and fried items, alcohol, smoking. You should avoid all these. Elevating your head end of your bed about 15-degree elevation. If you do from the head end of your bed, then it will help in you and quitting smoking, managing weight. You should lose your weight. You should change your shape, and the symptom of GERD will reduce with that. If these symptoms persist, you need to consult with doctor and get evaluation of your symptoms. You may have other pathological problem in your stomach or intestine, and that need to be treated with medications or lifestyle changes.
What are some go-to foods or some habits that can help soothe GERD?
So there are many foods, and like oatmeal, banana, non-citrus fruits are great option, and lean proteins and vegetables are easier to digest, and drink water in between meal, 1 hour before or 1 hour after meal, not with meal. Keep portion small or moderate. You should eat 50 to 70% of your diet only, not 100%, and never do overeating. Avoid carbonated drinks, the cola drinks, which sometimes people in common society think that they are reducing gas, but they are more gasogenic. Chewing gum is also gasogenic, and caffeine, alcohol, spicy food, these are all common triggers. And really about finding your personal balance and giving your gut time to heal. Fasting is also a very good practice that you should adopt to get rid of these symptoms.
Thank you so much, doctor, for breaking it down for us. GERD goes beyond discomfort. It's about maintaining everyday well-being. Thank you all for tuning in to the Gut Feed podcast, and I'd like to wish you all good health and comfort.